Welcome back to another live stream. It's Mike Mutzel. Thanks as always for being here. What we're going to do is talk about and break down the largest to date published study about natural immunity, reviewing the robustness, the efficacy of your body's own immune system to resist a reinfection from a pathogen that it's already been exposed to. Now, I know this is quite controversial. The media has told us over the better part of 24, 25 months now that we really don't know too much about the sort of durability of a prior exposure to a pathogen in terms of preventing a reinfection. There was a lot of shade sort of casted at this notion, this idea that the human immune system has some built-in redundancy and ability to recall immunologic antigens associated with pathogens. But this new study, published in none other than the Lancet Infectious Diseases, looked at analysis. This was Swedish scientists, looked at over 2 million samples here. These were individuals who had a combination of a few different types of immunity, and we're going to talk about that. First of all, these were individuals who had no immunity, that is, no documented prior SARS-CoV-2 infection. We have comparing and contrasting the outcomes in those individuals compared to individuals who have a documented prior SARS-CoV-2 infection, and then comparing reinfection rates to individuals who have what scientists are now talking about hybrid immunity. Now, hybrid immunity is going to be immunity that people have from having they either got vaccinated or got infected and then got vaccinated if they hadn't been vaccinated yet. So it's a hybrid approach where individuals have had the exposure to the whole virus and they have had a vaccine. That's what people are dubbing here hybrid immunity. So first of all, as always, friends, if you're enjoying this content, thank you for being here. Thank you for hitting that like button. Thank you for sharing this video if you find it helpful. Now, why is this even controversial? I'm not sure why it's controversial, but what I want to do is get into the science here. So I'm going to make myself a little bit smaller here. This is what I think is the take home here, and I'm going to read some direct quotes here. So here is comparing natural immunity to no immunity. Now, unfortunately, in this analysis of over 2 million individuals from Sweden, we don't have information on how many people had no immunity but only vaccinated compared to individuals who have prior exposure, i.e. natural immunity, but no vaccination. So what this cohort, I think, it's important to recognize and look at this. In the first column here, you have natural immunity, and what you're going to see here, I want you to focus in on the time point here, greater than 9 months. The risk of reinfection, and this is infections per 100,000 persons, is 0.6, right? So 0.6%. Okay, compared to individuals, and this is the infection rate per 100,000 who have had no natural immunity, right? So if you look at this and then you look in going further out, from 3 months to 9 months. So clearly there's robustness within this data set. And then we're also going to actually look at the direct papers. Let me just kind of switch around some screens here so we can go through. And let me make this bigger. Oh man, why is it not working? Come on. Okay, I guess I have to clear this layer. All right. There we go. Okay, so let's break down this paper. Again, I think this is important because the media, the politicians, the health experts said, we really don't know about natural immunity. We don't know so much about this, but this paper and some of the referenced sort of highlights here from various scientists are talking about, guess what? We should be promoting a hybrid approach, and we should be looking at, well, what is the beneficial effects of natural immunity? And if people have a documented or proof of an infection, whether it's through antibodies or through a positive COVID test, that they should be accounted for in, these vaccination health passes and all these things that are so controversial. Okay, so let's read to you some direct quotes so you understand what's going on, and then I'll share with you some of these images. I'll leave this part open right here. I think this is really important. Evidence before the study and then added value of this study. So background and perspective. So a new paper in the Lancet Infectious Diseases used Swedish national infection and vaccination registers to assess population-wide protection from SARS-CoV-2 infections up to October 2021. So remember, this is prior to the Omicron variant, which, as many of you know, is, although it's more transmissible, it's less virulent, it's less disease-causing, it's more mild by all accounts. Okay, so in comparison, convalescent individuals, those are individuals who have had an exposure and so forth to the virus, had a 95%. Let me go back here. Using a cohort of more than 2 million individuals, they showed that infection associated with immunity was 95% effective against subsequent reinfection during 20 months following up compared to no immunity. Now, the comparison that we would love to see is reinfection rate versus breakthrough rate. That is, people who have seen the whole virus versus people who have only seen the vaccine. And what are the differences there? Unfortunately, we don't have that from this study, although we have talked about that data from other studies in Israel. Now, what they go on to say, and they're introducing a somewhat new term to myself and possibly you, this hybrid immunity. Now, remember, it was considered sort of, you weren't doing your part, you weren't taking the pandemic seriously if you caught COVID-19. You weren't a masker. You obviously didn't get vaccinated. You're a bad person, right? Essentially. But now the experts are saying, well, actually hybrid immunity, meaning seeing the whole virus and getting the vaccine, is actually the best of both worlds. And they go on to say, in comparison to convalescent individuals who received one dose of COVID-19 vaccine, it exhibited a 58% lower risk of reinfection. So these are individuals who have hybrid immunity. They have a lower risk of reinfection. Now, these numbers sound quite significant, 58% and this, right? But the absolute numbers of reinfection are so low. There was only, I think, 3,000 out of millions of people, 3,000 reinfections for individuals who had a prior documented infection. Now, this is the important point here. Rates of hospitalization, I think that's worth diving into and talking about. We're going to get to that. But first, they say the implications for the available evidence. I think this is important. The risk of COVID-19 reinfection and hospitalization rates is low in individuals with a previous infection, which we know. Vaccination after recovering from a previous infection might result in additional risk reduction against reinfection and hospitalization for up to 9 months. But the differences in absolute risk appear small. And I'm going to highlight that and talk about that in a moment. In relation to determining proof of immunity, distinguishing between immune and non-immune individuals could be more appropriate than the frequently used terminology of vaccinated and unvaccinated. This, my friends, is so important. I just want to say this again, because I know you share these videos and it's important to understand that we mention this, okay? This is, like I said, very important. Okay, so they go on to say, in relation to determining proof of immunity, distinguishing between immune, meaning you've seen the whole virus, versus non-immune individuals could be more appropriate than the frequently used terminology of vaccinated and unvaccinated. Now, you might say, well, why is that? Because the rates of reinfection and hospitalization among individuals who are immune, meaning they've seen the whole virus, they've been exposed to the whole enchilada. They have T cell immunity, B cell immunity, they have antibodies and so forth. They have much more redundancy in their immune system responses and lower likelihood. Okay. Now, I mentioned that I want to get back to the absolute risk. Let me just highlight this because this is really important. We need to understand relative risk reduction versus absolute risk reduction. And so throughout what I've been reading to you, there was some numbers thrown out here comparing groups and the relative group risk reduction between, say, people who they don't have hybrid immunity compared to people who just have natural immunity. There was a 58% relative risk reduction in reinfection and hospitalization amongst individuals who have just natural immunity compared to individuals who have hybrid immunity. But the absolute risk reduction, the upper bound benefit of that is not exceedingly high. Now, I'm saying this because your employer, your children's schools, your nephew's schools are making low-risk people who have already probably had the virus very soon get a third and fourth dose of a booster. We need to understand, my friends, that the absolute risk reduction is not all that significant. Okay, yes, the within group differences, it sounds relatively 58% or 37%. You hear these numbers thrown around, but then you look at the absolute numbers comparing, individuals who are just have full-on immunity compared to full-on immunity plus hybrid immunity, the absolute risk reduction is not that significant, okay? So, interesting stuff here. A few things that I did want to point out that just so we're covering information as objectively as possible is this right here. The data also show that the long-term protective effect of SARS-CoV-2 infection alone, which was stable for more than 20 months follow-up. Important, my friends. We've heard on and on and on from my doctor friends who are within my family. Oh, we don't know how long it lasts. Oh, you better hope your natural immunity is sufficient enough. They throw these things around. You're like, the data shows this is more than a 20-month study. And lest I remind you that the information that we have from the from the 1918 Spanish flu, 90 years later, these individuals, in some cases, still have evidence of humoral immunity against the 1918 Spanish flu. Okay, my friends. So this is not like a novel concept. For some reason, in the year 2020 and 2021, common sense and the ability to think critically in these sorts of things sort of like clouded people's thinking, and they sort of forgot about the history of immunology and adaptive immunity. Okay. So important stuff. So they say that this level of protection was notable, meaning the notable protection from prior infection, considering the wide range of neutralizing antibody titers are generally mild in COVID-19. My friends, this is because, and I'll just make this screen bigger so you can see this, because we've been focusing so much on antibodies, but it's really the T cells. T cell immunity is where the magic happens. T cells are able to, the cellular mediated immunity is much more robust. And so forth. And so we've been unable to objectively quantify this because it's much more hard to sort of quantify and analyze T cell immunity. We have talked before at length about the t-detect.com assay, but that doesn't quantify anything. That just tells you if your T cells are responding specifically to SARS-CoV-2. So the scientists say, however, regardless of whether infection occurs before or after vaccination, the quantity, quality, and breadth of humoral immune response was vastly improved by having an infection. And so this finding supports for the notion that infection history should be an important consideration in determining whether individuals are protected against SARS-CoV-2. Future studies will be required to assess whether infection by distinct viral variants imparts differing levels of protective immunity and to better understand the epidemiological effect of infection across different variant waves. And I'll just say anecdotally, I don't know about you, but I've been exposed to so many people who have had the big bad Omicron, and I never got symptomatic. And the last time I had a documented SARS-CoV-2 infection was December of 2020. So I've seen a lot of your comments, seen a lot of direct messages and emails from people saying, hey, I got COVID during the first couple waves in the pandemic, and I never got it again. And I have people who have done things and they keep getting COVID, and we keep hearing that. So anyway, my friends, I did want to share the study with you. I think it's quite fascinating. I'm going to put the link to the study here, a little image, and I want to get to your live questions. It's been a little while since we've had a live. So again, if you're here live, thanks for that like button. Thank you for being here. Thank you for sharing this content. Let's get to the questions. We're a little bit later than we normally are. So politicians have made it controversial. Absolutely. Politicians should have never been in this area of, how should we say, government oversight with regards to a public health issue that, quite frankly, they don't know much about. They closed the gyms and left McDonald's open. What else do we need to say? Liquor stores and cigarettes were considered essential, but you couldn't go exercise. Enough said. Okay, Big Sweeney 007 says the title should be Biology Still Works, the same as it did before the pandemic. I know. Shocker. I know, it's shocking. Natural immunity actually works. Okay. It's unbelievable that the media has convinced people that their immune system doesn't really work. And yet then they are exposed to a little piece of the virus, but that works. But when you see the whole virus, it doesn't work. I mean, that is that's dumb. I'm sorry, that's dumb. That's just dumb. If you believe that, you're going to see a small piece of the virus, and that is going to protect you more than seeing the entire virus. Now, the counter argument to that is that, well, if some people see the whole virus, they die. The death rate from this virus, my friends, the infectious fatality ratio is 0.06. It's 0.6%. It's 0.6%. Now, that's an all-age IFR. If you break the IFR down to age groups, the individuals under the age of 65 represent an ultra small minority of the actual fatalities directly from this pathogen. Okay, Joseph Jones says, I've heard lots of testimonies from men losing testosterone from the thingamajiggy. I'm not sure about that, Joseph. I haven't personally experienced that because I wouldn't know, but I haven't seen any data on that. And I don't know mechanistically how that would work, but interesting. Carmela says, I have a cold. Maybe it's COVID. Who knows? Don't need to do a test. Tell me I'm sick. That's exactly right. So what do? Do you go to the grocery store, Carmela, and cough on everyone? No, you're responsible. You avoid crowds. You eat good. You go for a little walk outside in nature. You sleep a little more, have some bone broth, and you'll be fine in a couple of days, most likely. So great comment. Okay, Jerry says, sick for 1 day, unvaxxed. Well, I was sick for a day and a half, Jerry. I'm with you. I'm with you. But to be fair, some people don't eat healthy. Some people don't watch high intensity health. Some people don't exercise. Some people don't do those things. So for them, it's 2 weeks, and that's why we should have been promoting health the entire time. That's why we should have made nutrition, fitness, vitamin D, sleep, stress reduction, nature. We should have made that the main message, not wear your mask in your car by yourself. So Joseph says, please click and rank this video so more people see. And yes, Joseph, thank you for promoting. Just a shameless plug. If you're here right now, please hit that like button. Honestly, that goes a long way. And leave a comment if you're watching the replay. Thank you for that. That really goes a long way. Maria says, I had it in November, not vaccinated, and was horrible. Had pneumonia for months. Now I'm terrified to get it again. So the good news is, Maria, that because you had a pretty severe case, the probability of you getting a secondary reinfection after your immune system was on basically overdrive, if you think you're exposed to a lot of viral load, probably had, because you said you had it in November, it was probably Delta, so you had some sort of degree of viremia, high levels of viral load. High levels of viral load are going to induce a more robust antibody and T-cell mediated immunity. The probability of you contracting an even more severe secondary reinfection statistically is exceedingly low. So just rest assured that you need to now focus on getting your health back. Start to re-exercise again, move more, get some vitamin D in that, right? Again, vitamin D is not a cure-all. It's a piece of the puzzle, okay? I love this YouTube name, Crazy Backyard Chicken Man. I'm so sick of being the news across the globe saying, hope we did everything, when the first signs of the bat suit virus came out. No travel, zip it up, no travel. Yeah, I mean, it is interesting, right? The media are bouncing all around, Poland and all over the world, and everyone's jet setting and this and that. And and there's still high levels of virus circulating, right? So there's a lot of what we call hypocrisy in the media and the politicians and the established elite. You have these people have meetings in various countries. Joshua says, I appreciate that you're now being honest for non-political reasons. When I disagree with professional opinion, I'm only looking for a better one. Yeah, I'm trying to be as transparent as I possibly can, have been this entire time. So thank you for that, Joshua. Thank you for being here. 77 Adam says, U.S. makes you take your shoes off and most countries don't. Hopefully, I'm not sure I understand that comment directly. Oh, sorry, I was just looking. Okay. Do I participate in Ramadan? I do not, but I do intermittent fast on a regular basis. Keto Carb says, I watched a Fauci video the other day, and he actually said there's nothing better than natural immunity. Bingo. You know what? Let's play that video. I watched that the other day, and I thought, my goodness, how is it that Dr. Fauci is saying these things, and how did we miss this video? Let's give me a quick second. We're gonna play this. We're gonna play this right now. I'm glad that you brought that up. Okay, so here is America's most trusted doctor, Dr. Anthony Fauci.
She's had the flu for 14 days. Should she get a flu shot?
Well, no. If she got the flu for 14 days, she's as protected as anybody can be, because the best vaccination is to get infected yourself.
And she should not get it?
If she really has the flu, she definitely doesn't need a flu vaccine. If she really has the flu,
she should not get it again.
No, she doesn't need it, because it's the most potent vaccination is getting infected yourself.
I'll be damned. That's a little bit different from the messages that we've heard over the past several months, is it not? My gosh. Now, this video, of course, people will say, well, this, my friends, this was before COVID-19. It was for the flu. Oh, yeah, the flu. Oh, as if there's no variants of influenza. Do you all realize that every year there's a new influenza vaccine, a new flu shot to sort of predict the variants that might be circulating? So it's not as though this virus, influenza, doesn't have multiple iterations of variants, as does SARS-CoV-2. So people try to justify, well, that was said pre-COVID to say that as if it doesn't matter, but yet they at the same time acknowledge that there's multiple variants now of even Omicron. We have the XE derivative of Omicron. So it's not even SARS-CoV-2 anymore that we're worried about. I mean, obviously Omicron is a subvariant of SARS-CoV-2, but within that lineage, there's now like a whole secondary lineage and XE and all these different subtypes of Omicron, right? So the point being that the thingamajiggy that everyone is talking about needs to be updated to reflect the new variants, but they're not acknowledging that basic fact. So, like I said, friends, I'm just here to promote the truth. We know that natural immunity works, and in the 3,000 some odd people out of the hundreds of thousands who had a prior infection that then went on and got reinfected and hospitalized, I would imagine some of those individuals had a compromised immune system. So that was important. I want to point that out for purposes of being objective and unbiased here. There was a fair amount, like I said, 3,000 people compared to, I want to say it was 1,500 or something like that, or maybe it was 800 people. So it's about 4 times as many people who had hybrid immunity that didn't get vaccinated, that didn't get hospitalized, compared to people who had no hybrid immunity, just natural immunity, who got hospitalized. So there were more people who stayed out of the hospital who had hybrid immunity compared to people who just had natural immunity. But the thing that I want you to mention, to underscore here, is we don't know the comorbidities, we don't know the underlying health issues, and all of those things of the people who actually were hospitalized in that situation. So interesting stuff to keep in mind, to be aware of. Like I said, if you enjoy this content, if you enjoy this video, please share this with a friend. Also, just want to remind you, these shows are brought to you by Myoscience Nutrition, tools to help you support your athletic performance, to support your intermittent fasting lifestyle. We now have 111 some odd reviews of this relatively new electrolyte powder containing creatine, red mineral salt, albion chelated minerals, taurine, you got potassium, you got magnesium, you got a lot of really great things. Use the coupon code podcast at checkout to save. You can support your fast. It does not break your fast, and it will improve your exercise performance. So, friends, if there's no more questions, we're going to part ways. Last question here from Mindy. Where can we get the T cell count test? Here's the good and bad news about this. This doesn't quantify your T cell immunity. It just tells you if you've been exposed. It's through a lab, which I have no financial affiliation with, called t-detect.com, T-Detect. So check it out. If you go to our website, highintensityhealth.com, in the upper third or whatever it's called on the website, there's a blood work cheat sheet. On page 2 of that, you have all of your SARS-CoV-2 immunity-related biomarkers. Download that and check that out. Okay, friends, I see Christina, the carnivore, says, I still see people wearing gloves and masks and a face shield in the stores, in their cars. It's insane. I don't know. It's people have created these habits. Are they exercising? Are they intermittent fasting? Are they eating real food? Time will tell. But friends, thank you as always for being here. Thanks for that like button. Thank you for sharing this video. Have a great rest of your night, and we'll catch you on a future one down the road. Bye now.